came to the University of Iowa because I knew that it was a healthcare discipline campus. I started as a biology major, and I learned that the genetic counseling program was through the College of Nursing. Never in my wildest dreams did I think that I would be a nurse, but it ended up being the best thing that I ever did because it opened my eyes to a discipline I'd never thought of.
I was really attracted to a school that had a strong history of funded nursing research as well as national ranking for their clinical programs.
The University of Iowa is nationally recognized as a leader in gerontological nursing education and excellence, so it was a great opportunity to be with colleagues, collaborators, and to be on the cutting edge of developing improvements in care for older adults.
One of the most surprising things about the College of Nursing to me is the amount of research and scientific knowledge that's being developed through it. There's a focus on not only the quality of life and the quality of care that we provide our patients, but how to also advance nursing as a scientific profession.
The College of Nursing has put out new standards that are used across the world, new ways of changing practice, new ways of looking at problems and moving the profession, not just nursing, but also healthcare, forward.
I think the biggest misconception is that a nurse is a nurse is a nurse. There's such a broad area of focus for nurses to work with different populations and in different care settings. We're adapting a new telehealth technology. It's going to save money for our healthcare system as well as support these people who are trying to manage care at home.
My research, it's focused on family history of type 2 diabetes and how people interpret that risk. Eventually, the research will lead to new ways to have a conversation with people about their risk. How do they use that information to make healthcare decisions?
We have a unique set of skills that allow us to develop research that crosses lots of barriers or boundaries. My research specifically in symptom management is really about excellent nursing care. Having the opportunity to connect with patients while I'm also doing research and teaching students keeps it all very real and relevant. These are still issues that patients are experiencing every day.
I think that's a special skill set of learning that our role, we can have a wide impact on patients and families, not just in Iowa, but across the country.
Private support is extraordinarily important to students. There are a number of students who have to work and juggle school. So any type of private funding scholarship that these students can get is an enormous help to them. They are our lifeline to future health, and we owe it to them to stay up to date and to inspire them to want to do this as a career.
Giving faculty the financial support they need to get their research up and running is critically important for the college to both be competitive, but also for our faculty to succeed. We need to be able to get our research out there. I would definitely say that the work that I'm doing and the work that my colleagues are doing at the College of Nursing is going to make a difference both locally, within the state of Iowa, and across the country and internationally.
It isn't just hospitals anymore. Nurses are everywhere in the community. They're in the homes. The College of Nursing is preparing smart, educated leaders to be everywhere to support health of Iowans.
I am an Iowa nurse.
I am an Iowa nurse.
I'm an Iowa nurse.
We are Iowa nurses.